series of seminars on health issues, on other common issues of the community, as well as some issues related to US-India relations. And also, we provide forum to political leaders who are elected officials to interact with the community. And this evening, this is a health seminar, and it's going to be moderated by Jaya Daptardar. She is a member of our executive committee, a board member. A few words about Jaya. She is an Ayurvedic specialist. For the last 20 years, she has led clients to health and healing by sharing and transformating power of Ayurveda in her seminars and workshops. In addition to being the founder and CEO of Active Ayurveda and Yoga LLC, Jaya works as a Chief Operating Officer of a substance abuse and mental health company in Connecticut. She's a writer and she practices, and it's a great honor for me to present you the moderator for this session, Jaya Daptardar. Dr. Jaya Daptardar.
Thank you, Thomas. And welcome to GOPIO's Health Seminar. This is Aging Gracefully Part 2. We started Part 1 last year. So just want to say something about why we named it Aging Gracefully. At that time, I was writing a book, Aging Gracefully. And at the same time, the seminar came out, so we named it Aging Gracefully. So this is about, today's seminar is about self-care for living blissfully. And we have 4 special guests today. I'm going to introduce you to Dr. Shobha Jagdish. She is internal medicine, MD internal medicine. We have Dr. Kalindi Pandya today. She's a dental specialist. We have Chandani today. She is a yoga specialist, yoga teacher. And we have Dr. Pran today. She's a naturopathic doctor, she's a PA, and she did a lot of things that she will talk about it in her speech. So welcome again to the seminar. Before we start, we will do a 1-minute meditation. Just closing eyes. Please close your eyes. Dr. Shobha Jagdish. Dr. Shobha is an internist with Griffin Faculty Physicians with prior experience at the Cleveland Health Clinic and in the United Kingdom. So welcome Dr. Shobha for today's topic. And she is going to talk about self-care.
Thank you so much, Jaya, for inviting me. And actually, thanks to Yashi for thinking of me first to invite me here. So, I'm just going to move this.
Yeah, sure.
Aging Gracefully, Part 2. And I didn't attend the first session, so I don't know how many of you were there for the first part. Some of this may be a repetition. But I'm so happy to be here today to speak to all of you about this. I am an internist, as she said, so I practice mostly primary care and internal medicine. But of course, like she mentioned earlier on, it's all about the body, mind, and soul, all that will finally connect together. So I just wanted to start with just a basic structure of the human anatomy. So I think most of us know most of these parts. Amongst our community, the Indian community particularly, diabetes, hypertension, we all know it's very, very prevalent and people talk about it a lot. And I think, Jaya, last time you said somebody talked about diabetes and hypertension also. So I'll focus on that a little bit less, and I thought I'll just do a head-to-toe scan and just start from the top with depression and Alzheimer's. So we all know as we age chronically, there are a lot of chronic illnesses that with age is inevitable, but some of it is preventable. So I will just start with Alzheimer's, because that's something a lot of us worry about. When people start forgetting, they come to me and they're like, doctor, I think I'm getting Alzheimer's. So Alzheimer's is, by definition, is not just only being forgetful. We all forget, younger people forget, that's just more not being in the present. But when it comes to the point that you forget, that it interferes with your daily life, even if you're a younger person, in your 40s and 50s, if it interferes with your daily living, that is really Alzheimer's. And those are things where your family members will notice. You may, as you're driving, you may get lost, and there are multiple other things. But in addition to forgetfulness, you have difficulty handling complex tasks like checkbooks, reasoning. There's a part of your brain with reasoning, and that's because your brain shrinks, as I'll show you in one of the next slides. Your spatial ability, you lose that also. And you lose words. Word finding can be a problem with some people with Alzheimer's. So Alzheimer's is only one type of dementia amongst many others. It's just one of the most common. So if you see here on the, I don't have a pointer, but if you see on this side, which is the right side of the screen, or as you're looking the left side, that's a normal brain. And on this side, you can see there's so much of shrinking of a lot of the brain, which is what we find in people who have Alzheimer's. So as you age, that's one of the big concerns with a lot of people. And the next thing, which is connected to Alzheimer's in some form, but also I wanted to bring it up because depression is a taboo in our society particularly. Forget about the rest of society. As it is, nobody wants to admit they're depressed or even talk about it because it's something that is very difficult to share. And we know that as we age, with chronic illnesses, if you have heart disease, diabetes, we know that depression is just common. And it's not just grief where you lose a loved one or you move locations to a new place and you may not have friends. It's much more than that. Just like as I mentioned with dementia, you actually are to the point where it interferes with your daily living. You cannot enjoy the basic things of life. You don't find happiness with your family. You may not sleep well. You just don't want to eat necessarily. There are multiple things, and how we can prevent it is if you go to your doctor, there's a preventive screen that can be done. There's a special screening for elderly, and also for younger folks. There are certain questions we can ask, and you can tell if somebody is depressed or not. But coming back to what this main topic for today as prevention, depression can be prevented, not necessarily cured all the time, but it's well known that physical activity and exertion, as well as meditation and yoga, which I'm sure we'll hear more about later, all can prevent depression and prevent you from actually being on a medication. So a very, very common question I get asked all the time by patients is, I do screening for osteoporosis where we do bone densities. It's a special scan you do that looks at your bones. And patients are like, why do I need this? I'm not in pain. So osteoporosis is very different from osteoarthritis. So osteoporosis is where the actual bones have holes in them. And osteoarthritis just affects the space between the bones, but not really the bones itself in the middle of the shaft. So on osteoarthritis, the common sites are hips, knees, hands, where many of us over time we start aching. It's one of the types of arthritis and the most common amongst so many others like rheumatoid, for example. So I just wanted to allude to that because I feel as we age, it's a very common thing that we face. And this is osteoporosis particularly is an illness of the Asian population. And you can see here on the left side, this is a normal bone and a normal structure of a person when they're standing up. They're quite straight. If you notice some of the older people, as we see as people age, their back starts bending. And that's not always osteoporosis, but it's a sign that they may have it. And why we really worry about osteoporosis is because of fractures. You can easily fracture, even if you just trip over, a small spot, you can just fracture yourself. And so this is a normal bone on the left side, which as you can see, the bone is very compact in structure. And here, this is like a slice of a bone from top to bottom. And here you can see the holes are much bigger. Whereas, if you see in arthritis, you can see so it's numbered 1 through 4. You can see 1 is close to a normal joint. This is your knee. And as you get further and further along, you can see at the end, in number 4, where it says severe, there's more compression. And the redness is just depicting some inflammation. And this can be prevented, osteoarthritis, by weight loss and keeping a healthy weight and exercising. Those are the two common things. However, osteoporosis, there's a little bit more that one can do to prevent. Apart from smoking, alcohol, and just poor diet. There are some things which many of your physicians may have already spoken to you about to prevent this from a very young age. So that starts from, again, exercising, particularly when we flexibility exercises like yoga and weights. So we do forget about weights. A lot of us focus on cardiovascular activity, but weights are just as important. And that there's an indirect effect of weights on your bones that really strengthens your bones. And especially for women. This is more for women than for men. And I do find, and I may be biased, but in our Indian diet, and especially many of us are vegetarian, we do lack nutrition. And I think we just have to find it more time and effort to focus more on nutrition, like calcium, vitamin D, and protein particularly. We all have an assumption that dals and, pulses like rajma and chole are full of protein, but they also have a lot of carbohydrates. So we have to stay mindful of that. And we tend to eat actually much more carbohydrates than we need. So, the rice amount and the roti amount just has to start scaling back a little bit. So in general, for premenopausal women, or in general premenopausal adults, we need 1,000 milligrams of calcium. And once you hit menopause, the amount is 1,200. So there are a lot of supplements people use that you can use to prevent, but there's nothing that's better than the diet. So I have a little chart here which is just a brief summary of how much calcium is in a lot of consumption that we consume every day. And in general, if you have 3 servings of dairy, so which is 8 ounces of milk or 1 ounce of cheese, that's approximately close to 300 milligrams of calcium. So many of you may be already taking calcium supplements like Caltrate, calcium citrate, which is okay, but there's again nothing better than natural substances rather than medications. Sometimes they can constipate you also. So, and again, another problem that occurs progressively as we age because of the function of the body. So, but having enough calcium and vitamin D. So I didn't really talk much about vitamin D in a slide because it's debatable now whether we all really need vitamin D. It's been hyped, but I think a certain amount we all need to just stay healthy, and it also prevents depression. And I can't leave without talking about hypertension and heart disease. It's so prevalent in our Indian community. So hypertension, it's a leading cause of death and morbidity in our country. And I can't imagine there's not one person here who doesn't know an Indian who does not have heart disease at some level or form. So, but the first and foremost preventable one, I would say, is hypertension. It's so basic, it's so simple, we just need to get your blood pressure checked. And if you just have a physical every year, or even go to a pharmacy and get your blood pressure checked, you'll know. With that, there's one thing I want to just say, which I've not mentioned in the slides, but it's very common for people to think that if you're older, it's okay to have a higher blood pressure. It's okay for your top number to be 150, 160. That is no longer true, hands down. I have patients who've been so healthy and have had strokes. So no matter what, your blood pressure needs to be approximately 130 by 80, especially if you're diabetic, and it's very prevalent in the Indian community. Just absolutely don't take it lightly. But coming back to prevention, again, I feel like a drum repeating: exercise and salt intake and keeping your weight down. I can't speak more than that. It's just so important. But at the end of the day, if you need a medication, please don't be like some of my patients and just take the medication. It's just a pill. Some of all of this preventive things we try to do health-wise may just not bring it down. And they have very few side effects and it might save your life. And sodium, I just wanted to specifically talk about sodium because our diets, our Indian diets have a lot of salt in it. We love salt. And just so you get an idea, in our daily intake, anything more than a teaspoon is really too high, especially if you have hypertension. So that's 2,300 milligrams, this is in 1 teaspoon. It's hard to calculate, a lot of us love using our hands and just dumping it when you cook. So just to be mindful if you have high blood pressure. But again, it's not if you have really high blood pressure, you can feel, but it can bring it down from 1 to 5 millimeters of mercury. And this is just what your heart, the left side is a heart that looks completely normal. Excuse all the medical jargon of the structure, we won't get into that. But if you have high blood pressure, and you wonder why people get into heart failure or have heart attacks over time, and we always say that person was so healthy and well, because this is what happens over time, it's trying to pump so much and the walls thicken. So this is what we're trying to prevent. And again, I couldn't leave without speaking about diabetes. It's so common. Over time, what diabetes does is the sugar that floats around in your blood starts coating on the left most extreme is a normal artery, and the right most extreme is gradually increased. And you can see all those little dots are combination of blood glucose that's floating around that should not be there. And then when that comes, all the platelets and cholesterol, it's almost like, the glucose acts like glue, and they all start sticking together, and they love being in a herd. And when they stick together, they stick to the inner side of the artery, and that's how exactly many of us know friends and family who've had heart attacks, strokes. So once you've developed this, it's very hard to completely regress it, but you can prevent the development by just exercising, eating right, but being on the medications you really need to. And I won't get into a lot of the other natural things. Time up? Yes. Okay. Yeah, close to. So diabetics are 2 to 4 times higher to having heart disease than most of the general population. And apart from that, I don't know how many of you know this, but as Indians, as a race, our coronary arteries are actually smaller. I don't know the reason why, but we have smaller coronaries in addition to all of these. So we just are not very blessed with our heart, physically only. And I can't leave without talking about colon cancer because this month is Colon Cancer Awareness Month, and my husband's a gastroenterologist, so he would not be happy if I wouldn't say anything. So anybody 50 or above, if you've not had a colonoscopy, please get one. And if, for whatever reason you can't, there's a Cologuard, there's other testing. It's not as bad as we think. The gastroenterologist will not remember your face at all. So that's a big thing. People are ashamed to get one. It's not painful, but please get it. It's screening. We find precancerous lesions all the time. It's one of the top 3 cancers. And this is just, when they go in, they'll go through the colon, and with a scope, you won't even know. You'll be out completely. There's no pain at all involved. It's just that you have to prep a day or 2 before with the right kind of fiber and medications. So everybody please get one if you've not. And this is how I would love to age, just like my mother, aging gracefully and gracefully. It's a picture of my mom who's going to be 70. And Dhanyavad, thank you very much.
Thank you, Dr. Shobha. And I loved when you said prevention, because prevention is better than cure. And as Ayurvedic doctor, I always say that these are all lifestyle diseases. And in Vedanta it says, why they are lifestyle diseases? Because we do pradnyaparad. We do aparad. We don't keep in mind that we have schedule. So now our next speaker is dental specialist, Dr. Kalindi Pandya. I invite Dr. Pandya to talk about dental care.
So some of you are already my patients, and I see some familiar faces. I want to start by thanking Dr. Jaya and Dr. Thomas for inviting me today. Just to go over again that same thought that prevention is better than cure, that is very much true in dental diseases, because tooth enamel and dental tissues are the unique in the sense that they cannot repair themselves. If you have a crack in your bone, then if you immobilize it, then the crack can be mended, or a scratch or cut in your skin can repair itself. But if you have a cavity, it can't repair itself. So we have to be even more careful about not getting into dental problems. And the biggest thing that helps is maintenance. Our mouth is exposed to all day long to drinks and food and air and all sorts of things, and we almost abuse our teeth and our gums. So it is extremely important that we maintain it. And by maintenance, there are two things involved here. One is self-care by brushing and flossing, as all of you know, it's extremely important. And the second thing is visiting your dental professional every 6 months or at least once a year. Now, as we grow in age, brushing and flossing for some people who have developed arthritis, things can become more difficult. And nowadays we have many things on the market which can help. So I brought some of it. The electric toothbrush, most people are now aware of it. Not all the electric toothbrushes are made the same way. So get some Sonicare or Oral-B or one of the more established companies. They have really good products. And if you are not able to floss because of some kind of problems in the hand, or just don't want to do the regular flossing, there are this thing called hydro floss that has a little bit of jet pressure, and when you press the button, it actually gives a jet pressure between the teeth and can help to clean the teeth. There is this thing called gum stimulator that you actually put it under warm water, and then the rubber tip that is there becomes flexible. And then you use it between your teeth, and that really also massages your gum and can take out the bacteria. So that's about the oral hygiene. Now I'll go over the things that change in our mouth as we grow in age. There are mainly three dental issues that usually cause teeth to break down or also cause loss of teeth. So I'll go one by one and how we can remedy each situation. So the first one I will start with is dental decay or caries. In layman's term, we call it a cavity. So as we grow in age, we are prone to cavities just like everybody else, but as we age, the root tissue of the tooth gets exposed because of receding gums. Most people have some wear and tear on their teeth, and it causes the gums to recede. Now, the tooth enamel is the hardest tissue in the body. So it's quite a bit resistant to cavities. But our root, the root of the tooth, which is exposed once as we grow in age, that does not have tooth enamel. It does not have the outer layer of tooth enamel. The root tissue is much softer than the enamel. So because of that, it is much more prone to caries. So when you have root exposure, you might want to ask your dentist about special prescription fluoride toothpaste and fluoride mouthwashes. Some of you might have children who have gone through braces, and at that time the orthodontist asked them to use a fluoride mouthwash. Those can be useful, or special prescription strength fluoride toothpaste called Floridex can help. So that's one thing. The second thing is also as we grow in age, we tend to get dry mouth more easily. Everything slows down as people age, and dry mouth can also cause more proneness to cavities, because saliva has an automatic cleansing effect. which we lose. And also sometimes people who are on certain high blood pressure medications, which are called diuretics, it removes more water from the body, and because of that, if you are slightly dehydrated, then it can also cause the mouth to become dry. If you are experiencing dry mouth, you can ask your dentist, and then there are special mouthwashes. One of them is called biotin. I don't have it here today. But you can ask about it, and those kind of mouthwashes help the salivary stimulation, and that can definitely help. Now the second thing how you can lose teeth is periodontal treatment. Periodontium is the supporting bone and gums that keep our teeth in our mouths. So the one thing is that us Indians are not very careful about gums and maintenance. This is my personal experience, because as young children we did not visit dentists that often. But it is extremely important, as now they have evidence in literature is that when you have gingivitis or larger bacterial population, the bacteria that get generated around the gums get into your blood flow and can affect heart, and can also aggravate diabetes. Also, it unnecessarily challenges your immune system. So it is extremely important to always maintain the oral hygiene. If you have gingivitis, if you have bleeding gums, then you should go to the dentist and address it. The second thing is osteoporosis. Osteoporosis also affects the bone that keep the teeth in the mouth. So as other teeth in the body get softer, the bone around the teeth also get softer, and at that time if you have tartar and plaque and the oral hygiene is not kept well, then one can have, especially for ladies, one can have really drastic bone loss, and that can lead to loss of teeth. So that's another thing I want to mention. The third thing is that some of the high blood pressure medication have side effect of swollen gums. And if you are keeping good oral hygiene and still experiencing some or the other kind of bleeding gums or periodontal issues, then you can bring it up to your physician and see if you have another option of blood pressure medication. So this is about periodontal. The third thing that I want to talk about is tooth wear. As all the other tissues in the body, the teeth also wear as we age. But the wear is much worse for people who have habit of clenching or grinding their teeth at night. And it's a big population that does it, and it is done subconsciously. So a lot of time people don't know that they are doing it. But the way to tell is that if you keep on having broken fillings, or if you keep on having frequent headaches or jaw pains or neck strain, all those are symptoms that tell us that you are clenching or grinding your teeth at night. Sometimes it can cause loss of teeth when the teeth are fractured in the middle in extreme cases. So it is remedied by a very simple splint called night guard. It looks like this. It is custom made to your teeth. It can be worn either on upper or lower teeth, and you just put it in at night. It takes a couple of weeks to get used to, but in the long run it will save your teeth. So that's another thing that you might want to bring up to your dentist if you think you are clenching or grinding your teeth at night. The next thing I want to talk about is oral cancer. The cancer of tongue and cancer of jaw shows up in the mouth. Then most dentists and hygienists check you for that, but you might want to alert your dentist if they are not checking you for oral cancer. Usually, if you are a smoker or you have had a history of tobacco chewing, you should definitely be very careful. You can examine your mouth yourself. Lots of time the cancer starts as a precancerous lesion, which is usually a white patch. And that white patch which persistently stays there, and even when you try to scrape it, it doesn't go away. It definitely should be brought onto attention of your dentist, and they can send you to an oral surgeon who can biopsy the area. And if they remove the precancerous lesion, then you will not have to worry about getting it into cancer. So it's very important that those things are followed. I guess that's all that I have to say. I wish you all very good dental care, because a smile is the best thing that you will wear, they say.
Thank you so much, Dr. Pandya. And this information was really, really helpful, because we all want to save our teeth. It will not look good otherwise. And aging is a process which doesn't stop, so we have to save whatever we have, our teeth, our hair, right? Okay, so our next speaker is Chandani Rodriguez, and she's a yoga teacher. She's very passionate about her yoga. So she's going to show some chair yoga poses, and she's going to do meditation and breathing exercises with you, which is very important as we age. Thank you.
I don't know, can everyone hear me? Yeah.
Yeah, we can.
Okay, so I think I'm good. Oh, I'm good. Namaste, everyone. I am here today because my mother sent me. My mother was Purani Anjali, who came from India to this country in 1958, and she was the first South Asian woman to found a yoga center in ashram on Long Island. So this is her picture. And when Jaya asked me if I could come and talk about aging gracefully, I'm finding that this part of my life is the most powerful, most amazing, strongest, exciting period of my life. Aging, we always think is like, oh, our bodies are getting older, they were in decline. But for the yogis, who is really in decline? Are we in decline, or are our bodies just changing? There are two really huge powers which I'm sure you've heard. Shakti, Shakta, Purusha, Prakriti. One is change, one is stillness, one is the witness. In our bodies, you all close your eyes, just close your eyes. Just feel the body. Is the heart beating? Is there a little ache somewhere? Do you feel the hair on the back of your neck? These things are all moving. This is the world of Shakti. This is the world of Prakriti. This is the world of movement and change. Our bodies are made of all different elements. Matter, Prithvi, earth, Jal, water, Agni, fire, Akash, Vayu, wind. And all of those elements just make up our form. What actually moves the body is Shakti power. What is watching is Purusha. Gently open your eyes. So one thing, my mother wrote this beautiful book, and it's a book called Ritu, a collection of poems that she wrote in one night. And she wrote, the road ahead seems so far, yet looking back, I have come so far. Where am I? Let me read that. The road ahead seems so far, yet looking back, I have come so far. Where am I? Then she wrote another book. This one was made into a bookmark. Tomorrow, When I awake, I will see today. Tomorrow, when I awake, I will see today. What that ancient wisdom that came through her to all of us is that, I'm going to say this version again, is that we are always in the present moment. Yes, our bodies change, our bodies are going to change, and that's just the process. We are not going to be like the Buddha's parents, protecting him so that he doesn't know that his body's going to age. We have this great tradition that is all of our birthright, that we will change. Sickness, death, this is coming. But what doesn't change is that nature, that Purusha nature, and the life here is the two coming together as one. So, how many minutes do I have, Jaya? 3 minutes, okay. Would you all like to do a little meditation with me? Okay, would you like to stand up? Yes. We'll move it around. I was going to do a chair yoga, but this is some way that you can actually feel the energy. Move out a little bit, give yourself some space. You've got plenty of space. Stand with your feet hip distance apart. Really plant those feet in. Have your hands out. Close the eyes. Press into the feet. Send the tailbone down. Allow the spine to be straight all the way up to the crown of the head. This is mountain pose. We stand in mountain pose so many moments during the day. It's incredibly strong. We are bringing that tremendous energy from the earth into our bodies. We are always connected. This connection doesn't occur because we sit and we say, let us connect. No, this connection is occurring. Now, open the eyes gently and just follow me. Take the hands and scoop the air, bend the knees, gather up that air, and bring it up to the base of the spine. This is the Muladhara chakra. It's the root chakra. Bring it up a little bit more. This is the Svadhisthana, dark red chakra. Up to the Manipura. This is the Agni center. This is the solar plexus. Right up to your Anahata, your heart chakra. Turn the hands into Anjali Mudra. Press the thumbs into the breastbone. And just hold that. That is love. That is compassion. Bring that up into the lotus. Near your Vishuddha to speech. Up. Resting at the Ajna, the third eye. Bring the hands up into a full lotus. Above you, straight, straight, straight. Above you to the Sahasrara. Open wide. Open, just stretch out, stretch out. Now, reach from the hips. And just go down. Lifting the toes if you can. And bring the hands wherever they land. Near the feet. Press into the feet, bend the knees.